Okay, everybody, so let's talk about medications. Anyway, so just a little disclaimer or an FYI beforehand. If you have health insurance, yeah, it may cover things. I always tell people plan for the worst and then you'll be pleasantly surprised if they do end up covering it. A lot of times, at least here in Mississippi, it's about a 50-50 or maybe even a less than 50% chance that they will cover medication for like transgender purposes for transitioning. Sometimes they want a prior authorization filled out, which is basically a form with us writing a letter justifying why you need the medication, and sometimes it doesn't really matter how well we write the letter or anything. They're not going to cover it anyway. They're just giving a run around and being butts. So anyway, plan for the worst and then you'll be pleasantly surprised if they do end up covering it. And most options for hormone therapy are pretty reasonably priced, even if you're paying out of pocket. So hopefully it won't end up being that big a deal, even if they don't cover it. So anyways, moving on. So with testosterone, there are many different options out there. However, a lot of them are very cost limiting. And even if you have insurance that will cover some degree of hormone therapy, a lot of times they won't cover certain forms of hormone therapy, usually because it's expensive. They'll say it's for another reason, but they're just looking to cover the cheapest option. So we're going to go over the most common option first, which is going to be testosterone injections. With regards to injections, the average cost of like a month of testosterone therapy for injections is going to run somewhere between maybe $20 and $30. Every now and then you'll find a place that's like 40 or something like that. But if you look up goodrx.com and get one of those GoodRx coupons, a lot of times you can bring that price down. Be aware though that some places don't accept those for controlled substances, which testosterone is considered a controlled substance, unfortunately. So anyway, so injections, being about $20 or $30 a month, is a pretty reasonable price. It does, the injections do have a lot of the research and everything behind them. So, there's already very limited research available on transgender transitioning, as opposed to like hormone therapy being used in cisgender people. But the research that is out there is mostly going to be focused on injectable forms of testosterone, the most common of which is going to be testosterone cypionate. Some may pronounce it cypionate, either way. So testosterone cypionate, there's also enanthate out there. And enanthate tends to be a little bit more expensive, 2 to 3 times as expensive as testosterone cypionate. So we usually go with cypionate. Anyways, so with regards to injectable testosterone, what you're going to be doing is once weekly injections. Yes, there are different ways you can do injections. You can do, microdosing. You can do every 2 weeks, but here's the deal. So starting off once a week and then seeing how your levels do. The thing with microdosing and everything, it is great to keep your levels very stable. And microdosing, by the way, would be you'd be cutting the weekly dose into really tiny fractions and giving yourself injections either every day, every other day, or twice weekly or something like that. Number one, a lot of people aren't a fan of giving themselves an injection more than once a week. And for those who are wondering, why don't you start it at every other week instead? Because that's how cisgender guys do it. And that's how some transgender medicine prescribers prescribe it. Now, the reason we don't do that is because it doesn't make any sense to me why you would prescribe something that has a half-life of about 7 days for every 2 weeks when someone is getting into transitioning. Once you have fully transitioned, you're done cooking, so to speak, after a few years of being on T, going to every other week can be fine, or even every 10 days, depends on how you feel on the medicine. But whenever you're first starting off, it's really important to keep your levels, reasonably elevated and stable. So if you have a medicine with a half-life of 7 days and you go for every 2 weeks, that means you're going to have really good levels that first week and then kind of meh levels that second week, which, okay, whatever. I mean, you will progress on that, just probably on a slower scale. than someone who's doing weekly injections, which is perfectly fine if that's within your goals. Like, nobody said that you have to progress at a certain rate. It's not a race. But in general, we start people off with weekly injections and kind of go from there and figure out what works best for their body type. Most people, weekly is going to do the trick. 80-85% of people who are doing injections, maybe more, weekly is going to do the trick for them. But every now and then you'll run into somebody that has some kind of specific issue and they have to do it, twice weekly or something like that. Anyways, so that's kind of it for like injections. I do have videos on how to do injections and whatnot. It's not rocket science, so don't like build it up like it's some kind of crazy thing. But it is the more well-studied. It is definitely the more affordable. It's also the one that, if you have insurance, it's the most likely form that insurance companies are going to actually cover. And then it runs somewhere maybe between $20 to $30 a month, paying out of pocket. So pretty reasonably priced. Now, moving on to other options that are out there. So people are always asking me, what about pills? So there is now, there didn't used to be, but there is now a testosterone pill called Jatenzo. It's hellaciously expensive. No insurance company that I know of yet here in Mississippi is going to cover that for transgender purposes. And it's really not meant for like high testosterone levels. It's meant for like people who are like needing just a small boost of testosterone levels. So like I'm shooting for getting someone's testosterone levels somewhere between like 400 to 800, somewhere in that male range. And Jatenzo is not meant to be, it's not going to be shooting people's level up to like 700 or something. It's meant for like cisgender guys to just give them just a little bitty boost or something. Those folks that are having just kind of slightly low T levels. So anyway, hellaciously expensive, somewhere between $300 to $500 a month. Most insurance companies, or no insurance companies that I've ever run into, have ever covered it. So I guess I could just say all the ones that I've run into here in Mississippi, nobody covers that for trans medicine. So next would be patches. A similar problem happens with patches. No insurance companies really ever want to cover it. Sometimes you can get them to cover it if you have tried injections and like failed for some reason. But again, if you're paying out of pocket, it's, $300 to $400 a month. Okay, if you're just crapping money, go ahead. Some people, like about 25% of people that I've ever seen put on the patch, get a rash from it, which is just such a pain in the butt. The last couple of people that I got their insurance to actually approve the patches developed such a bad rash that they couldn't continue taking it. It just sucks. But anyway, so patches can be problematic. What are you gonna do if you can get it approved, or if you're just full of money? They're generally once daily patches, and hopefully they don't give you a rash. But anyways, the other more common and less rashy and somewhat less expensive option would be cream or gel. So that can run anywhere between $60 per month to $150 a month, just depending on your location and the pharmacy and whatever. Now, sometimes insurance companies will cover those. It's a lot less common to get covered than injections for sure, and sometimes they want to see that you have been tried on injections and failed, so to speak. How do you fail injections? Either you have just high anxiety over needles, but they're going to want you to have tried it for more than like a day, so kind of annoying. What are you going to do? But anyway, so cream or gel is going to be applied usually once or twice a day, depending. Average is $60 to $150 a month, so a bit on the pricey side. Now, if you're interested, we also have another option where instead of going to like a commercial pharmacy such as CVS, Walgreens, whatever, you could use our compounding pharmacy partner, which is Empower Pharmacy. What a compounding pharmacy essentially is a place that makes their own medication, so they don't get it like from the pharmaceutical company manufacturer, like the people, like regular pharmacies do. They don't like order and get it delivered to them. They actually make it in their facility. Most of the time they're making it in a hypoallergenic compound, so like if someone has an allergic reaction to a testosterone injectable, they're probably going to be allergic to the oil that this testosterone is suspended in. And then the compounding pharmacy would mix it in a different kind of oil that's hypoallergenic so that they would hopefully then not have that problem. Same with the cream and gel. So this is an option. Empower Pharmacy, essentially, you have to pay out of pocket though. So you pay out of pocket with the injections for like a 90-day supply of full dose testosterone. It's going to be like about $50 plus like $12 for shipping. So $62 for a 90-day supply. It's not too shabby. You can also buy your needles and syringes through them. I think it's like $4.50 for like a 10-pack of needle and syringe combos. So you get you a couple of 10-packs, you're good to go for like several months. But anyway, so injections through the compounding pharmacy is $50 plus $12 for shipping, and that's a 90-day supply. As far as like cream or gel goes, they're pretty similarly priced. Not a lot of difference in like application is fine. Different people like the texture differently of cream versus gel. Some people think one, evaporates off their skin or something easier so that they don't have that residue. That's more of a personal preference. The absorption rate is pretty similar between both of them. But anyway, so cream and gel for testosterone therapy is going to run somewhere around either $60 or $67 a month. The cream is $60, and the gel is $67. And then, like I said, $12 for shipping. You can buy a couple of months to save on the shipping. You only pay the shipping once. But anyway, so a little bit, that's a pretty reasonable price compared to what you'll find at a compounding pharmacy, especially if you have one of those that are charging over $100 a month for that. So anyway, so gel and cream definitely, an option if you just absolutely can't stand giving yourself injections. It's just going to cost a little bit more, especially if you go like through a compounding pharmacy or a regular pharmacy. Sorry, I can't talk. Especially if you go through like a commercial pharmacy. So nothing wrong with commercial pharmacies, just be aware they can cost upwards of like $150 a month for cream and gel, which is quite annoying. And then Empower Pharmacy, they've been pretty steady with their prices over the few years we've been using them. And then there is a last option that I will mention, which is testosterone nasal gel. That's usually applied twice daily, sometimes 3 times daily, depending on the person. And it's basically you just squirt a little gel up in your nose and then rub it together like that, and then don't blow your nose or wipe it or anything for about 30 minutes while it absorbs. That's about $50 for a month's supply from the compounding pharmacy. And then of course $12 shipping. So anyways, let's see. So we've covered injections, which are, like I said, they're the tried and true in most studies and definitely the most affordable when paying out of pocket, and they're the easiest to get approved by insurance. They run about $20 to $30 per month, or $50 for a 90-day supply through Empower Pharmacy. Pills and patches, just not well covered by insurance, and they are so hellaciously expensive. They're pretty cost prohibitive because of it. Cream and gel can be cost prohibitive to many people. Sometimes you can get insurance to cover it. It's, like I said, it's hit or miss. It's Mississippi, what do we expect? And then there's also, you can get that through compounding pharmacy, as well as nasal testosterone gel. Anyway, so hopefully this kind of went over everything for you. We want you to decide which kind you feel most comfortable with, and when you see your provider in your visit, definitely ask them any clarifying questions you need to find out up front that's going to make you feel, more confident about which choice you're making, because there's so many things that you need to decide on, effectiveness, cost effectiveness as well, as well as what you're comfortable with, because I mean, even though injections are easily covered, by insurance when insurance will cover it, or they're more easily affordable, you may not be able to give yourself an injection for crap, and so then you may have to opt for a different one. So keep all that in mind and just ask your provider, some good questions whenever you see them. Alrighty, hope everybody's out there having a good day. See y'all later. Bye.